We are all facing the global pandemic COVID-19. To combat the pandemic effectively, there is a need for mathematical modeling to describe the behavior of the disease. Most countries rely on mathematical models to forecast the future number of cases. For example, the figure shows the prediction model used in the United States of America, India, and Malaysia. Models use various assumptions and methods to produce the forecast. Many existing prediction models did not include some important factors such as the compliance level of the public to the rules and other interventions. In Malaysia, the Ministry of Health introduced the Standard Operating Procedures (SOPs) based on the avoidance of crowded places, confined spaces, and close conservation. SOP compliance is vital. Failed SOP compliance will spike the number of cases. We ask ourselves one big question: how to estimate the current compliance level of the public to the SOPs? This estimation is important to policymakers and health officials as they can infer the effectiveness of intervention strategies. Besides, it can give awareness to the public and motivate them to improve their individual responsibility by obeying the SOPs. Generally, it is hard to measure the compliance level of the public to the SOPs. Hence, we develop an improved mathematical model and a graphical user interface (GUI) for COVID-19 outbreaks. By using the GUI, the compliance level can be estimated by fitting the model curve to the data. For example, in Malaysia, we expect to see a decreased number of cases after the enforcement of the First Movement Control Order (MCO). However, in reality, the number of cases increased after the interstate travel is allowed on 10 June 2020. The model fitting shows that only 20% of the public follow the SOPs. Next, the Malaysian government imposed the Movement Control Order 2.0 on 13 January 2021, and we expect that the number of cases will decrease as shown in the graph. Means that if we have 100% compliance, we might be able to control the spread of the disease. However, this is not what happened in reality. The number of cases keep increasing. The model measures that only 40% of the public follow the SOPs. The timeline for COVID-19 outbreaks in Malaysia is displayed here. This video is recorded on 18 May 2021, the time when Malaysians are in the enforcement of MCO 3.0. The interstate travel was banned since January 2021. Now, the public is looking forward to traveling across the state border, especially to see their beloved parents at hometowns. We created the first complete, fully integrated, improved mathematical model with graphical user interface GUI for the COVID-19 outbreaks in Malaysia. In the GUI, a user can change the interstate travel ban lifted date and the percentage of people who follow the SOPs. After the user hit the Run button, then the projection graph of the number of cases and its corresponding reproduction number will appear. The real data of the number of cases was plotted by the black square symbol. The model fit is shown by the blue curves. The model prediction is represented by the red curve, which forecasts at a time longer than the data points. For example, let's simulate the model if the interstate travel ban lifted date on 20th June 2021 and 40% of Malaysians abide by the rules. To know the prediction value, a user can click on the plotted graph and refer to the Y value in this box. We obtained the copyright for this GUI on the 4th May 2021. For publication, we submitted an article to Journal of Public Health Research and ISI Index Journal. The current status is evaluation for the second review round. Some comments in the first review round are stated here. Technology readiness level, we are in TRL 5, where our GUI application is ready to be validated and demonstrated to the external parties, especially Ministry of Health and Majlis Keselamatan Negara. Applicability of innovation. Number 1 is Ministry of Health. Number 2 is Majlis Keselamatan Negara. The GUI is also could be generalized to worldwide as the model can be adopted to other countries. The GUI is accessible to non-mathematicians and not require programming skills. We received some feedbacks from Public Health. Professor Datuk Dr. Lokman Hakim, a professor of Public Health, mentioned that our proposed model supports the 7 strategies in RMCO, especially in embracing the new normal and community responsibility empowerment. I collaborate with Kementerian Kesihatan Malaysia with letter of intent to collaborate attached.